In celebration of National Community Health Center Week, the Alameda Health Consortium and the Community Health Center Network extend our appreciation to all clinic staff. While some individuals are receiving special recognition today, we want to congratulate all of you for your dedication and commitment to community-based health centers and the health of our communities. This reception is in your honor.
Ben Chow is the first person you want to run into each day. He always has a smile on his face. He's charming in the face of mounting pressures, and he demonstrates the highest standard of customer service. Currently, we are making a total of 8 different moves. Our headquarters moved to the BART building, our community services off-site, our new specialty mental health, 3 moves in 1 year, a new dental clinic, and 2 remodels in our main health center. Each of the new sites had to be rewired with new internet and phone systems. Even when the ink on the leases were not dry, he and his team were like special forces and secretly installed the major cables so that we were ready to go on time. He and his team also installed such a cool new phone system with special features, I don't even know how to use it. And he did it with a major discount. Great negotiation skills. Thank you, Ben Chow. What can I say about the development department at AHS? A fierce, fun fundraising machine with special community organizing powers. They've completed a $3 million dental capital campaign within 1 year. They launched our first planned giving program. They developed a new website and record-level social media hits. They've increased event revenue by 30%. And if that isn't enough, they've helped to pass landmark legislation to protect nail salon workers. In the meantime, they've solidified a Chinatown coalition of over 20 organizations to protect the livability of our community. So who are these superheroes? Mike Locke, Jade Aquino, Darren Yee, Lena Park, Connie Tran, Fung An, and last but not least, Julia Liao. Who can pull off 3 major events in the space of 1 week? 2 Quach can. 2 organize one of the largest general meetings in AHS history, 600 patients in 12 different simultaneous languages. An hour later, she played a lead role in an API roundtable with Lieutenant Governor Gavin Newsom. And 6 days earlier, she was busy organizing a new fund at the East Bay Community Foundation dedicated to supporting immigrant rights. This effort resulted in raising over $200,000 in 1 month. Dr. Quach is the head of Community Services and Research. As such, she makes sure our Patient Leadership Council understands and asserts their right to health care. At the same time, she is a leader in efforts to disaggregate data on API health disparities. This powerhouse makes us proud because she's homegrown. She started as a community health worker in our youth department, went off to get her PhD in epidemiology, and has come back to play a major role at AHS.
For their outstanding progress towards excellence in oral health, the West Oakland Health Council is pleased to recognize as its 2017 recipients the Dental Department. The Dental Department is led by our Chief Oral Health Officer, Dr. Pat Mason-Dozier. Dr. Mason-Dozier joined the Council last year in 2016 and has provided some amazing leadership since she took the helm of the Dental Department. Dr. Mason-Dozier tells staff and patients all the time that oral health is integral to overall health. The dental staff believe that we are in the best position to take care of the total patient. We have our partners in medical and behavioral health co-located with our dental department. We're going to put the mouth back in the body. The Council currently has 2 sites where patients can be seen by our dental team. East Oakland Health Center and West Oakland Health Center both see dental patients 5 days a week, and every 3rd Saturday, in her after-hours dental clinic in West Oakland. Dr. Jana DeLava and Dr. Eleanor Haley are the dentists who are supported by a motivated and hardworking team of RDAs and dental assistants. The dental team has endured a whirlwind of change. They went from paper charts to an electronic dental record system in a record-setting 6 weeks. This transition usually takes about 3 months. Along with electronic health record implementation, the staff has a new digital radiography, a new patient intake process, a new integrated care process, and plans to increase the skill set of all staff to better serve the patient population. This crew and department has gone through some major internal growth and transformation. Currently, the dental department is embarking on a much-needed facelift. Dr. Mason Dozier and staff are extremely happy about the new dental department renovation that is long overdue. Did I say it's long overdue? Yes, long overdue. The first phase of the work is starting this month. The West Oakland Health Council Dental Department's goal is to make this world a healthier place, one mouth at a time. Your smile is one of your greatest assets. Our dental department takes pride in helping to preserve that smile. So open wide. And congratulations once again to the West Oakland Health Council dental team.
The Chronic Disease Prevention and Management Program is led by Laura McLively, a registered dietitian and certified diabetic educator, and the team includes Shauna Puritan, a registered dietitian, and 3 clinical care assistants, Kathy Rodriguez, Jessica Gutierrez, and Sheila Barefoot, who works out of our SF clinic. In its beginnings, and because of its funding source, the NAF program had focused on the care of American Indians and Alaskan Natives, with the large focus being on diabetes. Over time, as many things evolved in our organization and in our community, the focus of NAF appropriately expanded to include all of NAHC's patients and additional diseases and prevention efforts. While that sounds easy, it wasn't without a lot of work. Expanding the focus of a program not only in terms of its focus, but also so it includes all of our locations, including our school-based clinics, wasn't easy and didn't come overnight. Fortunately, with Laura at the helm, the evolution did happen. Laura has proven time and time again to be open, flexible, supportive, and mission-minded. She's incredibly smart and funny and super talented. Have I mentioned she's also a blogger whose blog is turning into a book in 2018? Check out myberkeleybowl.com. Laura has built a great team, and together they are responsible for nutrition-based warm handoffs from clinicians, panel management activities, patient education, retinal photography, group visits, and training our clinical staff. This team is innovative, creative, dedicated, relentless, persistent, as our clinicians and MAs will tell you, quality improvement focused, and mission driven. It is an absolute pleasure working with this team. The laughter and learning are icing on the cake to the great work this team is doing. I'm proud to work alongside them, and I can't wait to see what they do next. And I definitely cannot wait for that cookbook to come out. Laura, Shauna, Kathy, Jessie, and Sheila, thank you for everything that you've done for the Native American Health Center, for its patients, for our community, and for being awesome colleagues to work with. We really do appreciate you.
Dr. Konda is one of the clinical directors for Tri-City Health Center. She is a one-of-a-kind physician who, through professional dedication, passion for her work, has continuously enabled all kinds of aspects across our mission. Dr. Konda is the first to volunteer her time for community events and to support staff when needed. Dr. Konda can always be found moving around the clinics with a smile on her face. No matter what the situation may be, you can always count on Dr. Konda to make a positive contribution to the values we hold. And for that, We want to personally thank you, Dr. Kanda, for being a dedicated member of our team and for always putting patient care first. And this is why we value and appreciate your excellence in clinical services. The Planning and Development Department is being recognized for its innovation, its excellence in advocacy, and community partnering. A lot of where Tri-City Health Center is today rests on the amazing efforts and hard work put forth by this department. In the past year, they have led efforts in opening the Irvington Dave Clinic and expanding the services for that community. The Planning and Development Department has been actively involved in outreach efforts, partnership developments, and community supports. They have continuously worked to secure grants. We really thank you, Planning and Development, for being instrumental in the recent expansion and success stories that we tell today. And for that, we want to thank you and applaud you as this year's outstanding department. Mr. Ryan Tanglow is the Training and Staff Development Coordinator for Tri-City Health Center. Ryan was voted as the outstanding employee for many reasons, to include being very resourceful and always willing to help others. Ryan has demonstrated to be excellent in team playing, has excellent customer service skills. Ryan has shown time again that he can remind staff in a respectful way of the urgency of requests and the need for things to be completed in a timely manner. Ryan is easy to work with and has a positive attitude about helping others. He takes initiative to research a project and to ensure from the start through the finish that the results have an outstanding deliverable product. Overall, Ryan's easy to work with. He's accessible, approachable, easy to ask questions to, and very respectful in his communication. For these reasons, Ryan, you have been recognized as an outstanding employee for Tri-City Health Center.